That?
It is homeinstead.com. And the I won't go into any detail again. With regard to the types of care available of the more traditional kinds. You know, we have the assisted living, the skilled nursing homes or nursing homes. They all vary according to degree of disability of the person. And they all will assess upon admittal the needs of the person. And these are usually based on the ADLs or the activities of daily living. This is an assessment that you can do yourself or keep in mind for yourself when the time comes. And it tells you if the person can bathe by himself or herself, dress, toileting, eating, and walking, even if it's assisted. If they have difficulties with any of those, then they are going to need some help. That could be laundry or meal preparation, shopping, whatever. A big factor in deciding where a person is going to go is the cognitive status. And we all know about, it seems to me, almost an epidemic of Alzheimer's disease. And I had no idea that there was even early onset Alzheimer's, it's called. And the government just on March 1st passed a new law that expedites the processing of all the papers for Medicare and Medi-Cal or Medicaid, rather, aid for these people, because that means a wage earner is being, more and more wage earners are being affected while they're still supporting a family. And in the past, sometimes the families had to wait for a long time before they got any benefits. And now that process has been speeded up as of March 1st. And that's a big step. That's a huge step because there are so many people out there today with Alzheimer's and other forms of dementia. This is important in deciding where, again, a person is going to go. So if they're not able to care for themselves, so they can't go to a retirement community or senior apartments or an adult daycare center, although daycare centers now are developing more and more, although funding has been cut back again. And they're particularly good with Alzheimer's and dementia patients. Then you have a couple of new possibilities. You have the continuing care retirement communities. They're very common in the States. I don't think abroad there are any that I know of. Then we have the, let's see, I don't want to forget anything here. Oh, something that was new to me is a residential care facility. And those are homes in a neighborhood that have gotten state licenses to care for a small group of people, up to 16 people usually is the maximum. And I found that most of them are far smaller than that. And they will even take people in wheelchairs because they're retrofitted for wheelchairs and that kind of thing. And they are in, again, a residential setting as opposed to a more institutionalized setting. The staff qualifications vary greatly, so as do the medical assistants. They may or may not have a nurse on staff. Usually they don't. They have a visiting nurse. If you have a medical appointment, they will provide transportation for you to make sure you get there. But the key to all of these is to asking a lot of questions. And there are certain key questions that are on a checklist in the reference material, and you should have a good, solid answer to all of those questions. And visit. Go back and visit 2 or 3 times, different times a day, talk to the staff if you can, talk to some of the patients, to get a clear idea of how the patients are being treated and the level of care. another important factor is odor. How many times have you walked into a facility? I did this recently. I was almost overwhelmed by the smell of either a very strong antiseptic cleaning material or urine. And so watch for those. There are also cooperatives, and these are, I think, a rather new thing where groups of women get together and they don't live together, but in a neighborhood or 2 or 3 neighborhoods that are well connected, they take care of one another if someone becomes ill or they have an accident or something. There's one that is quite well known, and they have a website in New York City, and that is a really good idea. Diane and I are part of what we call the soup group. We started out with 10 women, and it was impossible to meet with each of them during the month because of various individual schedules, and so we decided to get together once a month for just soup and salad, and now it's grown to soup and salad and dessert. But in any case, the idea was to keep the menu simple so we could just spend the evening catching up on one another. And I know that on many occasions, whenever I had a knee operation, for example, people brought me meals or came to visit from the group. So that's another way of doing it, founding or establishing your own small community to help out or to help other people. And then we have a new, I'm learning, field in the construction industry of building multi-generational homes. Now, to some of us who grew up with grandparents in the home, that is not so unusual, but for the younger baby boomers, I guess they're called, I hate that term, they are building these bigger homes with wings for in-laws or children. And as Dorothy pointed out a few minutes ago, children are coming home not only because of the economic situation, but because of a divorce or a separation. And so you can have a home that's big enough to accommodate all of these people, and saves a lot of money, I'll tell you. Okay, and we're going to take a short break here for a couple of seconds just